Here's the sterilizers. All the processing's done here by just a Haitian. Coming through the operating areas. This is one of the treatment rooms where I was putting spinals in for Dr. Kennedy, which he took over with an EMT and ordered all the ephedrine and sedation that he needed. Back out into the hallway. This is the decontamination room. Yes, I know. There's the sign. And there's where they decontaminate. Into my OR, it'd be OR 2. Here's the guidelines I had to follow. Turn the suction off, turn the anesthesia machine off, turn the cautery units off. Here's the OR. Through the door. Prep stand. There's the Bovie. Not enough Bovie pads or Bovies. We were alcoholing them off in between cases. There's our suction. Worked sometimes, not others. There's my oxygen tanks, which bled dry. There's something no problem there, but we couldn't find it. The operating room table. Every patient came in. There's the door. Took their shoes off and put them there. Got on the table. I set all my spinals up on that little stool. Never turned the machine on. Put the monitors on though, and away we went. We did have more than enough laryngoscopes and blades. Lots of medications. We were surprised. Ambo bags, thank goodness. IV solutions were a bit of a challenge, a lot of dextrose. But pretty much could find what we needed. Just the supplies for the surgery rooms. Kathy and Audrey seem to find everything. Here's my needle bucket. How do you like that? It's a Cascade dishwasher detergent box. And there's the crooked clock on the wall. And back out the door. These were where the carts were lined up when we take patients out. There's the cart. We couldn't fit in anyone's room because the bed is a bed mattress. Here's the scrub sinks. Masks. Hallways were a little congested, as you can see, as I'm trying to get through here. Here's the bathroom. It's either occupied or it's open. No lock. Lori's OR, OR 3. Pretty much the same as the one I was just in. Her machine was maybe a little better. And there's actually air conditioning that functions in this room. Otherwise, kind of the same setup. Lori's stuff. OR lights. No handles, no handle covers, so we had to direct them all. They do have, we can code a patient, as you can see over there. And just the supplies. Just walking around the room. Their suction never worked. It was kind of interesting. And this is what our oxygen comes from. Back out the door. Onto recovery. These would be the mops we use to scrub both rooms. Never change the water all day. I guess kind of the equivalent of the nurse's desk. I think they can do dental work with that. I'm not quite sure where they do it though. That's where our water and coffee was set up midday. This would be the med room. Kind of surprising at the meds they have here. Lidocaines, I think these are all locals. But they were telling me that this is all improved as a result of the hurricane or earthquake. So there's that. Then we have different cardiac meds and nebulizers. Lots and lots of Diprovan. This is all meds, pediatric stuff, more propofol. Again, all of this, a lot of this still needs to be sorted. Hespan, woohoo! A lot of Toradol, but you get the idea. Loads of stuff. Not a lot of organization yet, only because it's a little overwhelming. Out of the med room we go. Back out to the doctor's station versus... This is like the recovery area. Patient's family stay with them. There's some. That cute little girl's been here for a while. Nurse's station. A computer? Holy moly! That's good. That is good. This is our little girl that we did the amp revision on. Caught the rubble of the...
He's her husband, so there's not a problem to see her go back to the market. So she needs to know about the dress.
Dressing? We'll show them, probably change it once a day.
Once?
Yeah,
Just once today.
once straight.
Today?
Une fois. Chaque jour.
Chaque jour.
Oui.
Ok. Ici, moi, probablement, on va faire pansement une fois par jour.
Oui, on connaît, mais possible ça aider.
Nous connaissons, they are not living by here. They are living so far from here. So they want to know how that could be done.
We'll probably give them some dressing.
Okay. By the way, some nurse.
We'll show them.
We have a about it too.
Okay. You got la botte, pansement et
Okay.
deux heures à sortir, donc n'importe miss et aussi à côté à café restaurant. Non, justement. Ça, on est sur café, ok?
Même pas faire un mix, pas de machine.
Ok, non, justement, si que David lorsque la tour a commencé la pluie, de temps en temps la pluie, c'est David la ramasser l'autre.